Hello and welcome. Today I interview Dr. Raof Gharbo, a physical medicine and rehabilitation specialist who helps his patients take a more mindful approach to chronic pain. He uses exercises that synchronise breathing and heart rate as a first line of treatment. I think his approach is quite unique in that he uses biofeedback devices to measure heart rate variability and quality of sleep, and also combines his approach with coaching methods that help the patient build a sense of trust and hope in the recovery process, also whilst focusing on adapting so that they can progress in their life according to their overall sense of purpose. So some really useful elements, I think, from a coaching point of view. I hope you enjoy hearing Dr. Garbo's opinions.
My life's work, chronic pain, neurorehabilitation, is about teaching people to break free from persistent sympathetic activation, all the various terms for that: anxiety, stress, uncertainty, so on and so forth. The most objective starting point in my mind is resonance frequency breathing. For the people who say, I tried meditation and I don't get it, I tried that or this and that. Let's take a step back and let's just try the objective skill of modulating your autonomic nervous system objectively. It's the training wheels, I believe, to meditation. It's the training wheels to kinesiophobia that prevents people from moving, fear of injury. It's the training wheels for, we're in one paper we're going to put out, an artist who had chronic pain. It was the breathing that allowed her, and some medication changes that allowed her to get back to her creativity to break free. So when you're stuck in persistent sympathetic activation that wears you down, grinds you down, I think the breathing is the training wheels, and it's creativity in the face of stress that can grow brain as opposed to the opposite. So
just sorry to interject. When you say an objective starting point, breathing is the starting point and it's an objective measure. So by that you mean that a person can, using some device like a heart rate variability monitor, they can get a real-time measure that they can see on a screen, so there's no arguing with that, and then they can experience, as they change their breathing, they can experiment moment to moment and see the results moment to moment. So then there's no arguing.
Thank you for reeling me back in.
That's all right.
Yeah, no, that's fantastic. So there's this debate about top down and bottom up. And when I go on and on about bottom up, meaning diaphragm, heart, frontal lobe, people think I'm saying cognitive behavioral therapy doesn't work, so on and so forth. What I'm saying is it's both. You've just neglected bottom up. Okay, so it's both. You need to make decisions in your frontal lobe to adapt to COVID and the real world and your brain injury and the new stresses at work or your family. You do have to do top down, but bottom up, I believe, is a starting point. What I mean by that is the diaphragm is your secondary pump to your heart. And if you learn the skill and with exercise make it stronger, you can shift into an energy efficient state that we can measure with heart monitors called heart rate variability and so forth. When you shift in this synchronized physiological state, your body changes physiologically. It goes via the vagus nerve to the brain, and the brain picks up, well, maybe from the neck down, we're not in the fight or flight response. And it can allow you to get from the emotional, survival, aggressive parts of your brain to your frontal lobes. And I like to say that's where your purpose and values are. Remember, well, maybe I don't need to win this texting argument. Maybe it's more important I get some sleep so I can be kind to people and help people heal tomorrow. Because if I don't heal tonight, I'll struggle to heal others tomorrow. But sometimes you got to win that texting argument, right? You just got to, because it's really important, because it's going to change everything. no, it's probably going to grind you down. So when you recognize that, the breathing, so it's bottom up. For me, it goes diaphragm, synchronize with the heart, support the heart, vagal tone, get to the frontal lobes. And so that's bottom up. It complements all these other interventions that are top down.
Okay. Yeah. So if you're going, so top down doesn't necessarily lead to synchronization of heart rate and breathing and possibly all these other biological oscillators that create a coherent state. So there may be, you may by, thinking through stuff and positive thinking, that may lead to a calming, but it's less likely. Is that what you're saying then?
No, I'll use the word stuck. When you're stuck, go bottom up. Because one of the things I proposed in 2013, if I can, first of all, if it's reasonable to believe that we were made with a single emotion to trigger the sympathetic fight, flight, or freeze survival pathway, that our bodies are made up of these two pathways, gas and brake. Is it possible that fear is the fundamental emotion of that? I think that's not a reach. If you think that that's at least reasonable, then I would say to you, if we're built that way, whether it's God, evolution, or both, there's room for both, then there's probably something for the braking system. And I would say the opposite of fear is trust. So I believe trust is parasympathetic. So trust is the foundation of all relationships, even adversarial business relationships. There's still a level of certain rules that trust, or certain people we trust to keep everybody playing the game correctly. So, so there's trust. So and I believe there's first, second, and third person. When people have these great moments of change and so forth, or these moments of spiritual healing, I think it's a combination of either trust. They suddenly have trust, convinced they have trust in themselves. Sometimes they have trust in others. Sometimes it's something bigger in the future. So I believe trust can augment the parasympathetic system. So it can be top down. If you can just, some people change their health by whatever set of circumstances, they suddenly trust themselves, or they trust the environment they're in, or they trust the future. That would be top down. You made a choice.
The placebo effect is trust, isn't it? We're trusting in, the label paracetamol or whatever it is to provide a more effective treatment than the Tesco's home brand version. So therefore, it's more effective.
Yeah, and we're destined to try and confuse everybody, make us the experts. So we're going to use words like expectancy and things like that. But what is the placebo response? It's hope. What is hope? It's trust in the future. So it's some sort of treatment to give you trust in the future. So I like to say hope is a process. I don't think it's ethical if you come to me for me to put your hope in me, a device I'm going to sell you. I want you to put your hope in yourself and a process. So you have hope in the future. And so putting it on you is teaching you these breathing techniques to augment your autonomic nervous system. Feel that change. Think clearer. Recognize what is my purpose and value. And suddenly you're uplifted because you've learned the skill to modulate, to break free. So now you trust yourself a little bit better. the process I've published, I believe, is intuitive. I call it autonomic rehabilitation.
Mm-hmm.
You're stuck in persistent sympathetic activation and you trash your parasympathetic system. We can measure its flexibility and capacity with breathing techniques, tests, and we're going to rehabilitate that. So that's the process. And then for you to have hope in the future, when people are stuck and they can't break free, they can't make those decisions that other people seem to, in different situations can't, then back up, do the breathing, clear your head, and again start reset and let's look at things again. But when people lose hope, they've lost hope in the future.
Mm-hmm.
And it's free will decision making. So the limitation, anybody talks to you about more and more and more brain training, the limit to brain training, because we have plenty of studies. You want to come to me about quitting smoking, we can do brain training and get you to, with intricate little habit formation, get you to quit smoking.
Mm-hmm.
But when COVID comes and now you got to adapt to something else, you haven't really learned anything.
Mm.
So the studies show Ian quit smoking, but he started doing a bunch of whole other bad things when COVID hit. So it's mandatory that you learn the breathing technique so that you can count yourself in the future to be able to adapt. And so one more point. So if I give you this intricate habit formation, you haven't really learned what to do next. You've won this little battle, but you haven't won the war.
Mm-hmm.
So
the brain, so there's the hope. We need to have a hope and trust in something to make it possible to shift out of this fear state, this parasympathetic activation, into sympathetic activation into parasympathetic, more relaxed, calm, trusting state. But that's, in order to do that, we need to train ourselves so that we know we can experience and feel how our body does that. And you're using breathing, heart rate variability as a measure for synchronized breathing or resonant breathing. But also for the longevity, the person needs to have mastered that skill so that when the next stressor comes along, they know, okay, they feel the phenomena happening. They may feel some sympathetic activation coming, but they know how to reverse that and to switch back.
Right. And the other thing is there's this incredible competition for your hope. It's called marketing. What is marketing? I mean, there's a little device, right?
Mm-hmm.
But the marketing is about this device is going to change your life. And so that's what marketing is. It's the placebo response. It's hoping it's this device plus this special something, right? Yeah. Wearing a $75,000 purse, there's something special about it. So what I want to do with this terminology to get a whole team on the same program, physical therapist, the psychologist, the interventionalist, to actually hold physicians accountable to where they're guiding hope. You can't guide hope for a pill, knife, needle, electrode, ivory tower, or a white coat. Hope is a process. Let's knock this out and figure out what process. But I can't, when you come to me hopeless, I can't put it in that device or me or the institution I happen to be standing in. So it gets the whole team hope in themselves and hope in a process.
So maybe another way of saying that, the hope isn't a blind faith. It's to be realized through the training and experienced. And then the proof is in the pudding, as they say. So, you have this initial hope, then you learn the skill, and then you don't need to be hopeful anymore because you start to see the results, and then you can just return to that skill whenever you need it.
So anybody who's had chronic pain recognize they can go to 4 different people and have 7 different opinions.
Mm-hmm.
Hope in that. So if we can at least agree that we're not going to put it, in the shiny thing in my pocket, that's off the table, that at least we're now communicating as a team based on science, based on safety, based on all. Let's agree on the principles. And then suddenly you're going to get a consistent theme from each of the people I interact with. It's kind, it's mindful, but there's still this element of accountability. I need you to self-regulate before you make this decision to speak nasty or to whatever it is, to do it before you walk, because you're too afraid to walk. You may injure. You need to do the breathing to clear your head. Okay, I'm going to do some walking. I'm going to see my limit today, as opposed to being afraid and not trying at all. So step back, clean your head with the diaphragm, and what's my goal? So in one case, one of my patients, her goal about, I could always bring her back, is a beautiful 4-year-old daughter, and her goal was to break the cycle for her daughter, that she didn't have to deal with a childhood full of persistent sympathetic activation.
So I'm guessing what you're saying by that is she recognizes that as she grew up, her parents were chronically stressed or in a persistent sympathetic activated state.
Right. So we know that almost 40% of women with chronic pain had some sort of abuse in childhood, and so she did too. And what she wanted more than anything was to break that cycle for her daughter. And she came in with back pain, and she also had a stressful life, but she had to learn the breathing to clear her head and then make those decisions. This frenemy she had would constantly trigger her. Well, you need to do the breathing to decide this frenemy she has versus it's really about her real purpose. It's about breaking this cycle for her daughter.
So I don't know, frenemy, is that, do you mean friend enemy? So someone who stresses you out, supposedly a friend. Okay. Haven't heard that one before.
Yep. So we all, from time to time, we all have a frenemy.
Yes. Okay. Just on the science now. We don't need to go into.
By the way, it's not a medical term.
Frenemy. Okay. No. No, there are those old models of the skull, though, aren't there? With, I can't remember what it is, with different things.
Homunculus.
Possibly, yeah.
The homunculus. Yes.
Homunculus, yeah. Yeah. That's the closest thing to a frenemy I can think of. But so the science, like, I was thinking earlier when I was anticipating this meeting tonight, and I was reflecting on the Valsalva maneuver, which is used commonly in hospitals for people when they're, as either a diagnostic or to help reset an arrhythmia. Let's say you try the Valsalva maneuver, and actually that's a breathing technique. You're bearing down, holding your breath, stimulating the baroreceptor reflex, and that's affecting the heart. So there's no argument really that breath modulation affects the heart and that's almost like a defibrillator to reset the heart. Whereas what you're suggesting is more like a pacemaker. So you're doing this practice. So why do you think why do you think this isn't recognized more then?
We're getting there. There's been, 1992, the Framingham study in the United States, Framingham, Massachusetts. This is like the gold standard of heart studies. We follow this entire town since the 1940s. They find that HRV is the biggest predictor in 1992
Okay.
of cardiac health. And the literature, high quality medical literature on diabetics, brain injury, cancer, everything is showing that this is the marker of whole health. Anxiety, PTSD, chronic pain, they all have reduced HRV. And it's modulated by the diaphragm. And so think of the diaphragm as your backup support pump. And when you go for autonomic testing, they call it the autonomic screen, but it's about 5 or 6 tests. But even that's really complicated. It needs to be simplified, and it can be. And so what's happening right now is the digital age is crunching all this data. We're getting the wearable tools. COVID has just escalated telehealth. And so we're going to draw on all this data for decades that everything was cumbersome. And we're starting to figure out the beauty of this science. And so the even more important test is called the HRV response to deep breathing. And that's 5 seconds in, 5 seconds out. It maximizes your HRV. Well, interestingly enough, that's also heart rate variability biofeedback. So the test is the treatment. The test is maximum diaphragm excursions. How will that affect the efficiency of the heart? Sucks in blood, pushes blood out. Maximizing the HRV is a measure of whole health. So we should be able to get the tools out there where we're testing this regularly. And in fact, the American Diabetic Association, the American Academy of Neurology, both recommend that the HRV response to deep breathing, which again is essentially resonant frequency breathing, that when you're first diagnosed with diabetes, you should have it tested again in 5 years, because it's the biggest predictor of diabetic complications long term before you even have the diagnosis of diabetes. It's a ridiculously sensitive parameter. So I believe with the tools that are available and the platforms, this should be institutionalized in schools, employers. We should all be regularly practicing our breathing skills. And that way, you're not meeting me in your 40s or whatever, and you're already in bad health. And I'm trying to teach you breathing techniques. Most kids have these, and we push it right out of them, these skills.
So how do they have them? What do you mean?
Well, by making everything so time intensive and competitive, children typically have much higher resonant frequency breathing, and if they haven't gone down the path, if dad hasn't pushed too hard to try to make them the best football player in mankind's history, if they haven't done that for too many years, they can return to it very easily. But the longer persistent sympathetic activation, the more rigid the system is.
I remember watching somewhere another interview where it was explained that, similar to what you said, all children breathe better, and they were talking about it from belly, the belly breathing in a simple way. It's only on average before the age of 10, sometimes most children shift to like shallow upper chest breathing. Do you know if there's any, is there any proper research to show that? Have you come across it at all?
I don't know if it's proper research, but I know for myself, it's still even, think of the words, force myself to let go of my belly. Because because it doesn't feel right, right? I've been looking at television and pictures and marketing my entire life that you shouldn't let your belly go. And I suspect there's some sort of subtle message kids are getting about having a tight abdomen and a large chest, you know, and so forth. But to maximize heart rate variability, to maximize your diaphragm as a tool to modulate your heart, to change the signal to the brain, you need to relax and do diaphragmatic breathing, which can become unnatural. So it's natural in a 6-year-old. It becomes unnatural. We have to go back to it.
Another question I have, which is more of a philosophical question because I've not come across any evidence. Why do we shift in and out of coherence? Why do we need to go out of why, from an evolutionary point of view, do we actually lose coherence when we're in this hypervigilant, sympathetic, activated state? Why can't we stay coherent?
So some of this is conjecture. So at night, we do what? We cycle through different stages of sleep.
Yeah.
And some of it is deep sleep, and some of it is deep sleep with REM, and some of it's not. And what's going on? So you can think the way I think of sleep is so I think of the driver of the Grand Prix Formula One car. That's the brain, okay, and the car is the body, and the pit stop is you're awake, you're doing resonant frequency breathing, the driver's taking a break, but the body, the pit crew at night is working like mad. So when you're asleep, that's not hibernation. That's a metabolic state. You're fixing stuff. Hibernation is reducing all your metabolic demands and saving as much energy as possible. So sleep is active. It is healing. So when you sleep, it's not sticking the car in the garage. It's in the pit stop. The driver is taking a break, but the pit workers are working like mad. But getting to your question is, why are you moving from so the body is still, but the brain between REM and non-REM is going sort of sympathetic and parasympathetic back and forth, and then you leave deep sleep altogether. And why are you doing this? I believe it's transmission fluid. You need the flexibility to move in and out. If you're only going to resonant breathe, you're going to get up on top of the mountain and you're only going to resonant breathe and expect other people to feed you, you're going to be a tub of goo. So you do need to work hard. That's why your sympathetic system is there to fight. Whether fight meaning plow a field or fight an animal, but you need that. And so the breathing helps you move between those. The decision making helps you move between those. But when you're focused on becoming that best football player in history, you're never going to take a break off of that, and you're only going to work hard. You will lose the flexibility. So when somebody is calm the night before the big competition, somebody may be rigid and say, well, I shouldn't let go. I should stay focused. No, you need to give that a break to heal so you can be prepared for tomorrow. So I look at sleep and this ability to breathe as transmission fluid, to be able to shift different gears. If you're driving at 5,000 RPMs and I'm driving at 2,000 RPMs, and you're stuck always at that, that's going to have consequences. The breathing is going to help you shift gears. and you match that to whether you're highway driving or driving in the neighborhood. You have to decide with your eyes and what you see. That's how you adapt. Does that help?
Yeah. Yeah. Yes. Yeah. So it's not, it's not all about being coherent all the time. There's an advantage to the other state.
So when you sleep, you want to stage 3 deep sleep. You want to be robustly parasympathetic.
Mm.
Yeah, we we want variation. If the other extreme of variation would be, say, a video game player, okay, that takes naps, has the delivered to them. They play the game and they go back to sleep. And they play the game, go back to sleep, and they don't really move. Okay, so there's not much variation in anything they do. But the greatest variation, the two extremes for me, is let me see how robustly parasympathetic you are in stage 3 deep sleep, where it should be maximum diaphragmatic excursions, maximum recovery. And also, when you exercise, how high is your heart rate for how long? So the maximum variation between load and recovery is also a measure of health. So we've spent decades on this, right? Acceleration, power, endurance. We are now getting the tools to assess recovery. So heart rate is one of many measures of load. The HRV is a measure of recovery. You brought in the diaphragm and the heart combined together efficiently. And so I want to know, how much recovery are you getting? But you also need exercise. And the bigger the gap between those two, the healthier you are.
So when you're working with clients or patients, you use a nighttime monitoring device then. So something that's measuring their heart rate variability as they sleep as an indicator for how well they're recovering. So it's not just about the training during the day, the breath training, it's measuring their recovery as well.
Yeah, so there's 3 basic elements to the treatment model. I need you, this digital age is relentless in pushing us. So there's plenty of people I call out there, load experts. You come to me and you're a cricket player and I don't know cricket, but that's fine. You have plenty of people on the other side of the ocean to push you to become a better cricket player, okay? That's fine. That's load. You keep at it as much as you want. I'm a recovery expert. I got to get you to value recovery. How do I do that? I want to measure your HRV every single night. And so when you have 3 bad nights in a row and you see your numbers are tanking, that you start making better decisions. So I call it being intentional about recovery. So I need one tool to rein you in from trying harder all the time because somebody's working harder than me because my daddy told me I should always work hard and all that. So I need a number, and a number's great because there's less debate. It's a number. You stunk the last 3 nights. No wonder you're more irritable. No wonder you can't do your math problems quite as well. What do you need? Do I need another pill or 2? No. Probably need some good, decent sleep right now. So I need you to value recovery. The other is I need you to modulate it real time. And that's the HRV, resonant frequency breathing, biofeedback, these tools that can tell you and tell me remotely, if you got the device on, and I tell you to breathe 10 minutes twice a day, I can tell if you're doing it, A. B, if you're doing it well. C, if you stink one day, I can ask, hey, what happened that day? Oh, yeah, I was trying to win a texting argument. Okay, well, what's your purpose in life? I'm not telling you what to do. I'm just asking questions here, right? You came to me. You want to get better at playing cricket. I'm not sure winning an argument about United States politics is going to get you to be a better cricket player. Or
That's what I really like about your approach, is that it combines with that coaching element. So you're asking the person to see whether their life goals or their purpose is tracking well with the day-to-day stuff.
Right. So one of the first law of emotion is based on thermodynamics, is that energy is finite. You only have so much time and energy, and so you better know what your purpose and values are. You're going to flounder. And to hit that home, because all high performers cut corners on sleep, I need a device maybe like that to rein you in. That you can't cut corners on your sleep for 3 months.
No.
It's going to deteriorate. So, we're very resilient. We can trash ourselves and our body for several days, but after several weeks, it's going to take a toll on your physical and emotional health and behavior. So recognize that energy is finite, and so now you need the skill to get energy efficient. So when you turn these breathing devices from red to green, you're getting energy efficient. When you're practicing, right, told you to do 10 minutes twice a day, you are lubricating with transmission fluid the ability to shift to different levels as appropriate.
Yeah.
COVID is a real threat, right? This text is not a real threat. Recognize that through the breathing. So once then I use, Socrates, or I don't know if you're familiar with Quakers in the United States.
Yeah, we have we have Quakers or they have friends meeting houses. So Socrates, you mean the Socratic approach of
yes, it's asking questions. Right. But first, I got to get you to calm down. I see a lot of angry people, so we got to calm down, but and get to know each other, and I got to find out what's your purpose. And then once I can hold you accountable to clearing your head, once I've convinced you that energy is finite, then it's just questions. I'm not telling you what to do. Is this a wise allocation? Is this a good energy utilization? And one of the things that people love about my methodology is it becomes crystal clear that I'm not judging you. You decide on your purpose. Now, if your purpose is to hurt people, and we have different values, we're gonna part company. But I haven't run across that. People's purpose and values are usually aligned, and so then it's easy when you recognize they're obliterating a value. I got to make valuing recovery a value. I need a tool to do that. So I do need to introduce some new values, like valuing recovery. And when you obliterate that, I can show you some numbers, describe some consequences. Let's do the breathing together here for a little bit. And now you tell me, let's look at this again, this choice you made.
Yeah, absolutely. And I found that approach to be powerful as well. People may come with an immediate problem that they're frustrated with, or this immediate pain, but then I personally find it can be quite hard sometimes to get people to identify their purpose or what they want. It can take a few sessions because they're so kind of caught up in the current pain or the situation that they want to get rid of. They've lost sight of, or they can't identify easily with what they want, and it takes a while to actually bring their attention to that and to get them to identify it.
Absolutely. And a life of purpose has conflict. And we have more than one purpose in our life. Everybody has conflicts between their personal purpose and their professional purpose. Going to have to sort those out too. So it's not about being conflict free, but it is about free will decision making. But when you ruminate, and so the core feature, I believe, of persistent sympathetic activation that makes you inflexible in your thoughts, you can't break free, are fear ruminations.
So future thinking the what ifs of the future.
Right. And so even if you're stuck on being angry about something, the root of it is fear.
Mm.
And we you, and sometimes the only way to break through the anger is to do the breathing long enough with a tool, because they're going to fight you and brush off the breathing. So just turn this red to green, create some sort of incentive program for angry people to turn a device from red to green. Just do that for a couple weeks before we engage on the topic. One question I always tell people is, and I'm going to save you hours, and I doubt you do this, but never ask anybody why they're angry ever again. Never, ever, ever do it. It's just a waste of time. You ask the question, open-ended, what's going on? You gotta breathe through it yourself. You can't get hooked saying your model is stupid. This is a waste of time. You're charging me too much money. Or for a coach, when they tell you, I don't care, or this drill is stupid, you got to breathe through that until you keep asking open-ended questions until they say, I'm scared, I'm terrified, I'm worried, a fear. Now they've dropped the nugget of their rumination. And you have to hear it. And you have to validate it in some way. Have to. You will not get anywhere without doing that. You will be in this therapeutic group if they are not heard.
Yeah.
They do not say their fear and they do not get validated. But that's a real fear.
That reflective listening, here, making sure they feel understood or as best as possible. Is complete understanding ever possible? I don't know, but to feel.
Maybe you don't understand. I haven't had a spinal cord injury, and I'm not paraplegic. I treat people like that every day. I don't know that, but it must be incredibly difficult. And so I don't necessarily have to know it to validate it.
You've heard it and validated it, and then that opens them up to the next stage, which is avoiding future ruminations. So once you've acknowledged that they're fearful in this present moment, then you can suggest that do they need to be anxious about the future or challenge that?
So the classic fight, flight, or freeze is fight it, avoid it, or shut down. I'm offering another one, a different one. We're not going to extinguish that fear, your fear of future XYZ, future loneliness, future pain, but you can defuel it. That doesn't mean extinguish. So breathing will not eliminate loneliness. Breathing will not cure lumbar stenosis. If I separate current and future, you can defuel the fear of future loneliness, the fear of future pain. I'm going to validate lumbar stenosis, paraplegia, loneliness. They suck. Okay? They stink. But this fear of future pain, loneliness, etc., is fuel for that fire. And so you can defuel that before. And so they need to hear both. And so mindfulness made me very disciplined about past, present, and future. The past cannot hurt you in the future if you accept the past and you can defuel it.
and to recognize that you're actually at the moment, you are in the present, and the past isn't actually affecting you, isn't actually the present. So to distinguish between the past and the present. Fantastic.
So one of the things that people with PTSD, they're very afraid of the future. They want to find a way to keep from getting triggered. They're afraid of being triggered. Okay? To unwrap that, this terrible event happened to you. Your amygdala will have that locked away forever. Why? Because it hates you? No. These emotions are built to protect you. So you recognize that it is there to protect me. I will forever be afraid of barking dogs because I was attacked as a child. Thank you, amygdala, for reminding me that barking dogs have a danger. Now, I may have an over-triggered response than you, and I'm afraid of dogs. We do have to get to a point where we accept the past. Okay? So this is part of who I am now, not you. I got chewed up by a dog as a kid, and it didn't happen to you. That's part of who I am now. So I have to get people to accept they will be triggered, that they are forever different. But there's a confidence. If you've proven over several weeks that you can defuel that triggering. So instead of being afraid of future triggering, you accept future triggering. Learn the skill to defuel it. And now I won't destroy my relationships by the way I behave after I'm triggered. Wow, there's a process to have hope in.
I agree pretty much with everything you said about, being triggered in the future. You'll always be triggered in the future, but what you're saying is the person, if with the appropriate training and the awareness that when they are triggered, they can use resonant breathing or whatever technique to reduce the sympathetic activation. So they're defueling the trigger. My understanding or my experience is that it's possible over time to achieve a state where the actual trigger, the amplitude of the trigger, let's say, doesn't go as high as it did in the past. So it's not only about defueling it, it's that, this whole allostatic flexibility, that over time you can actually reduce the initial extent. So the defueling becomes easier and easier and easier and easier and easier. And you can pretty much get down to a very minuscule trigger.
Yes, and decisions are part of that. Am I now going to decide to stay focused on that? Or am I going to, there is an element of decision making and also an element of healthy avoidance. Yes, that's absolutely true. The brain, that's the point. The brain can grow and plasticity, but the core is still there. You're still going to get triggered. But yes, the amplitude of the trigger, the duration of the trigger, the exhaustion from the trigger, those will absolutely, HRV is the best physiologic measure of PTSD.
Wow. Yeah.
So we can measure that over time.
Simple.
Well,
so you're doing great work, and I see other people doing similar great work, and things are moving forward, and we've got this, we've got the likes of Fitbit and Strava and all these other massive companies collecting loads of data. Where's it going to be in 10 years' time? What do you predict?
Yeah, that's a nice way to end. I'm very hopeful for 10 years from now, with increased integration. where, you know, where the kids in school learn how to get still, and then they keep that skill and not lose that skill each year. And then we're more healthy, flexible adults, mentally flexible adult. So I'm incredibly optimistic. Let's say for the kids that are born 5 years from now, incredibly optimistic for those kids. But yeah, when I raised my kids, it was when, you know, when cell phones and Facebook first came out, and there was no parental guards, and you know, so I'm optimistic that we're going to learn how to adapt to these things, and there's going to be integration, and the breathing skills will just be institutionalized. That when we're escalating, and we'll be able to speak about difficult topics while we self-regulate, and we recognize I accidentally triggered you. Take a minute. You know, I noticed I triggered you. I don't know what I said. Something in your past, or I was
tone of voice, anything
flippant about something, that we'll be able to. It's just a physical thing, right? It's nothing. That way you don't instantly think I'm XYZ. You recognize it's a physical thing with you. I recognize it's a physical thing, and we both just simmer down. I'm really optimistic that there's going to be healthy things institutionalized.
So the health breathing is institutionalized, and also maybe reflective listening or nonviolent communication would be taught as well.
Right. And that breathing test, you know, I'm talking about for diabetics, that it's not when you're 40 and you just became diabetic. It's when you're 18 and 22, and then at 25 to 26, you really dropped off. Let's investigate that. Was that due to emotional trauma? Do you have a new cancer? Do you have diabetes? Your numbers dropped off between 25 and 26. That's what these tools and things like are going to do. Instead of coming to me at 40, I think you have diabetes now. At 25, we saw some sort of drop off.
Ever so simple, and can be done at home and by anyone, as long as you've got some device, some measuring device.
And safely put into a medical platform. So.
Fantastic, thank you.
It's a pleasure to talk to you.
Yeah, and I've used heart rate variability monitoring for several years, and but outside of standard medical care. But it's, I totally see the value of combining it with a coaching approach and communication and some understanding of rumination. I see how they all fit together. So I really love your autonomic rehabilitation concept. So thank you for sharing.
Thank you for having me.
Cheers now.
Cheers.